We're Sentia Health. We're in the business of streamlining and automating processes and have even automated the production of new software. Today we are going to talk generally about the state of health insurance in the US, and medical coding in particular. According to the American Academy of Professional Coders, AAPC, medical coding is the transformation of healthcare diagnosis procedures, medical services, and equipment into universal medical alphanumeric codes. The average medical coder reviews 78 charts, codes 89 claims, submits 79 claims, and appeals for denials. Medical coders make about $55,000 annually. There are 3 participants in the medical transaction: doctors or practitioners, patients, and the insurance company. What are the benefits to doctors? Quite frankly, there aren't any. There is nothing about medical coding that makes a doctor's life easier. In fact, the only outcome is lower profits, wasted time, and additional staff for the practice. What about the benefit to patients? Flatly, there are none. The only outcome of coding from the patient's perspective is higher cost. The only benefit goes to the big greedy insurance companies. Frankly, this is a bad fix to a problem that shouldn't even exist. In an effort to save money, the insurance companies require doctors to translate the procedures they perform into these codes. The codes are not suitable for documenting the patient encounter, but the insurance companies don't care. They say no codes, no payments. This is a case of the tail wagging the dog. The patient's care is what is important. The insurance is an afterthought, as it should be. The dumb business guys got together and did what they always do, the most stupid thing possible, so it is easiest for them. There are 341,600 coders in the US right now. Multiply that by the $55,000 per year from above, and you get about $19 billion per year. Now that doesn't sound like a lot until you start taking it out of your pocket. There are 300 million insured people in the US, and they average a little more than 3 visits per year each. That means that you personally paid almost $20 to have 1 doctor visit coded. That doesn't seem like much, but it doesn't need to be charged to you at all. It is wasted money. It is brass polishing on the Titanic. Worse, this is $20 for every visit for every insured man, woman, and child in the United States. As stated above, you nor the doctor received any benefit from this at all. This is indicative of the almost evil practices the business of insurance foists on the unsuspecting public. Miles Ma published a paper in May of 2023 titled, "The Quiet Way Health Insurance Companies Have Made It Harder to Get Medical Necessities Covered," detailing exactly how insurance is using coding to quite literally reduce your benefits. I'll add a link in the description. In some cases, this shameless profit chasing is killing people, denying necessary medical coverage because they don't want to honor a signed and ratified contract. Medical coding is just one way that the big, stupid, greedy insurance companies waste your money. The best estimate I have of exactly what is wasted is that 47%, about half, just disappears. This $20 per visit is in addition to that 47%. Think about all the monkey motion. Think about all the people, all the big buildings, all the equipment and power wasted by their gross ineptitude. Last week, I detailed a new kind of insurance company that only manages data. This new company provides the electronic medical record system, EMR, to the practitioner, free of charge. That captures the patient encounter in English, or the language of their choice. There are no codes or coding required. This is built on the Unified Medical Language System, UMLS, provided by the National Institutes of Health, NIH. With this new EMR, the new company can capture procedures performed in real time and pay for them as they are documented. This avoids the whole coding and adjudication process. Adjudication is someone sitting at your insurance company and deciding why they aren't going to pay for your procedure. There will be more on this in subsequent videos. We have described a new way to fund healthcare. For the privilege of managing your data, we charge a very Netflix-like $10 per month in lieu of the 47% legacy insurance companies waste. Let me know what you think in the comments. I will do my best to read and respond to as many comments as possible. Please remember to like and subscribe so you can get notifications of what we are doing, thinking about, and producing.